Hello, and welcome to this edition of Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today we're going to discuss one of my very favorite subjects, perhaps my very favorite subject, and that is the many and varied health benefits of exercise. And not only are we going to discuss why you should exercise, we are also going to discuss how you should do it. And that is how you, the viewer or listener, can start your own exercise program at home, or if you're already doing one, how you can improve upon your own exercise program to look better, to feel better, and to get healthier. To this end, I have the great pleasure of welcoming my friend and colleague, Dr. Matt Gammons. Not only is Matt a board-certified sports medicine physician, he's also a former college athlete, having played soccer at UVM, go Catamounts, and he's an avid and daily exerciser as well. Matt, thank you very much for coming and welcome to the program.
Yeah, thanks for having me.
So I thought we'd start off by asking Dr. Gammons the difference between activity and exercise.
Well, I think it's an important differentiation for our patients, because I'm sure you do. We have lots of people that come in and say, well, I'm very active during the day. Why do I need to exercise more? Activities such as walking, just doing daily activities around the house, those sort of things are important. And the more active we are, the more it's helpful to our overall health. But that's different than having a very specific time where we exercise to the point where we're raising our heart rate to get other health benefits from exercise.
So a lot of my patients, Matt, are very, kind of cancer phobic kind of thing, including myself. And I just wanted to take a minute here to talk about, the effect of exercise and cancer. Prevention, treatment, give us a couple minutes there.
Yeah, so like many things, we don't understand all the factors that go into, it's obviously why certain people develop cancer, but there's a fairly large amount of research that shows that if you exercise, particularly moderately, most days of the week, and we can talk about what that means a little bit more, that many types of cancers, you lower the risk of that. Now, some of that may have to do with other health factors as well that go along with exercise, but clearly there's some benefit in that. There's also benefit in people that actually already are being treated for cancer or have cancer in terms of both health, overall health, survival rates, and just general wellness and how they feel about their things when they're going through their treatment. So, if somebody is saying, what's the best thing I can do to prevent cancer? Well, it depends on the individual cancer a little bit. But if somebody's just globally saying, hey, I don't have a specific risk, in my family or specific genetic risk, by far, exercise is the best thing they can do.
That's a really good point, because I have a lot of my patients, they're cancer phobic and they don't want to develop cancer. And what I like to tell them is, listen, rather than just sit around and worry about it, go out and do something. And it's great that we have, have this evidence that exercise can prevent cancer as well. Tell us about some of the other health benefits of exercise.
Well, again, when we're talking about specifically exercise, we know, again, if you're active, and the more active you are, the lower your overall risk is of having things like strokes and heart attacks. But if you take that activity to the next level, and what's the next level? Well, the next level is at least moderate.
Okay. So what's moderate exercise?
So moderate